We showed you this video yesterday here on Fox & Friends. A traffic officer in Austin, Texas, saves a woman's life by giving her the Heimlich maneuver. She was choking on a biscuit in her car.
Get it? Did you get it?
He pulled her over because she was on the phone, didn't know she was choking. But what would happen to you if you were choking and nobody was around to help you? Here are some tips on how to save your own life. Is internist and women's health contributor, Dr. Keri Peterson. Good morning to you.
Good morning, Steve.
That is such scary video to look at.
That was terrifying. She was so lucky that she was pulled over because that could have been very life-threatening.
Absolutely. All right, so let's say you're choking. You're by yourself. What do you do?
Well, you want to perform the Heimlich maneuver on yourself. So how you do that, Steve, is take your fist, put it above your belly button, put the other hand over it, and using short, sharp thrusts, pull upward, push upward as hard as you possibly can. Now,
and what are you trying to do? Get the air in your lungs?
You're trying to push on the diaphragm so it expels the air from the lungs and dislodges the food. But if you're choking, you can get weak very quickly. So
sure.
If that's not effective, you can use the edge of a chair or a sturdy table by literally throwing yourself. You want to just line it up with the upper belly and, again, forcefully, as hard as you can, push upward in sharp thrusts.
It's going to hurt you.
Yes.
But you're choking to death.
Yes. You do it as hard as you possibly can to try to dislodge the food.
I've heard of this actually working with people.
It can definitely work.
All right. Let's say you're all by yourself. You're running down a road or something like that. And my heart, I think I'm having a heart attack.
So if you're experiencing chest pain or shortness of breath, these are potential symptoms of a heart attack. The first thing you should do is chew an aspirin. Now, if you're not at home, that's a good red flag that if you have risk factors for heart disease, carry an aspirin on you. And you want to chew the aspirin. That increases the absorption much more quickly. Don't swallow it. Chew it and then swallow it.
Also, if you swallow it, it might get stuck.
Well, yeah, it can actually get lodged in the esophagus.
And that's not helpful to you.
That's not going to work. And that's going to prevent clot formation in the heart.
Okay, so you could do that. If you have risk factors, carry an aspirin with you.
And aspirin also, lie down. That decreases the workload of the heart. And take deep, deep breaths. That will increase your oxygen supply to the lungs and hopefully help you out a little bit.
Okay, what if you are out, you're by yourself, you're a distance from a phone, and you hurt yourself to the point where you're bleeding severely?
So if you're bleeding severely, you have to act quickly because you can lose blood very, very rapidly. So you want to take a cloth, a piece of clothing. Let's say you hurt your arm, Steve.
All right.
You want to put it on there and squeeze, grip as tightly as you can.
Okay. On yourself.
On yourself, and elevate your arm above your heart. If it happened to your leg, you want to lie down and put your leg elevated into the air, which is, again, above the heart.
Well, if I'm laying down, how am I going to get help?
Well, hopefully you'll be a passerby.
Yourself.
I mean, the most important thing is to stop that bleeding. So if you want to rip off your shirt, put it around on your leg as quickly as possible. You also, what you don't want to do, there's a misconception, is to put a tourniquet on yourself.
It would be so easy right there. That's
to just squeeze
bad, right?
It actually could do more harm than good if it's not done properly, because you're actually cutting off the blood supply completely, and you can lose oxygen supply to the limb and lose the limb.
What about, I've heard if you're bleeding, you put your head between your legs?
You actually don't want to do that because if you do faint, you could fall on your head.
Straight down that
You could fall on your head. What you'd rather do is lie down instead.
All good advice.
If you do get an object embedded in your arm, don't pull it out. It's actually helping to form a plug, and if you pull it out, you could worsen the bleeding.
It makes perfect sense. Yeah. All right, Dr. Peterson, thank you very much.
Thanks, Steve.
Ways you can save your own life if you're all alone. Thank you, Keri.